I was diagnosed with Peyronie's disease. I went to my HMO, primary care doctor, and I sort of described what I had, but he didn't know what I was talking about. I tried to, tell him in so uncertain terms that my penis had a curvature in it. It wasn't alarming at that time, and he didn't pay any attention to it. About 6 months later, I went back to him, and this time it was 3 or 4 times as bad as it was the first time. And then he sent me to a specialist. When I talked to the urologist, he knew exactly what it was. I explained it. He says, "Oh, you've got Peyronie's disease." He drew a diagram and told me what was happening down there. The first thing he had me do was take steroid pills for about a week and vitamin E. That proved to no avail. So then he mentioned a very expensive topical cream that I could put on that. And I investigated that and found out the cost was prohibitive. I realized that the cream was going to cost me a fortune, and it wasn't going to make any significant difference. And the cream was close to $300 a month, just for a little tube of cream. So, and I had to take it at least 3 months, possibly 18 months, and there was still no guarantee. So the cost was almost out of the question. I was kind of casually dating, but actually when this started to happen, the severity of it just almost kind of prevented me from going out. I mean, it was just a psychological thing. Like the curvature was so pronounced that, it was almost like laughable. I would have to explain it, and I mean, it's kind of uncomfortable. So, but it was psychologically, it was pretty, to my ego, it killed me. So I tried to make light of it, and I did tell some people about it, close friends that wouldn't laugh at me, and I made a joke of it at work. I made a joke of it at work once. "Yeah, this guy, he's probably got Peyronies disease." "Well, what do you mean by that?" So my boss looked it up back in his office, and they said, "Wow, that's a weird disease." "Well, what made you think of that?" I said, "Do you have Peyronies disease?" I said, "No, of course not." Because I realized that my only alternative was probably surgery, and I knew I had to get a second opinion. When I exhausted the HMO, and he was a urologist. The HMO specialist was a urologist. He didn't have someone like Dr. Gelman. Dr. Gelman was the only one there that knew about Peyronies. Well, that's all he does is diseases of the penis. It doesn't do anything else. So I immediately felt comfortable knowing that this man was a specialist. If I was going to have anything done, I would have it done by him. But no, bottom line, he was my doctor from there on in. And then I think I realized then that surgery was my only option. I mean, it was a no-brainer to me. The curvature was so bad, and I had seen pictures on the internet of some of these people, and some of them were so grotesque, worse than mine. And I know the cream wasn't going to help anyone, and I'm sure. And I started thinking about, these guys were a lot younger than me. This can happen to anyone. It's been 4 months since surgery. The erections happen whenever I want them to. I haven't had intercourse. I'm sure I can. I feel like I would have to probably explain my short penis. But then again, I don't know until I get to that stage. I mean, it's probably, I'm sure most men will go, "Well, God, I've got a short penis. I still have sex," and I know men that they can't get an erection without Viagra. Or some men shoot something right in the middle of the side of their penis to get an erection. And then there's the other procedure on the penis that one of my best friend's brother had back in Indiana, and he was only 48 years old, where they put 2 rods on either side of the penis and a pump in your under your scrotum, and you got to pump that up. So I mean, my dilemma is not that bad. I just have to get over that little bit of fear. Well, anyone suffering Peyronie's disease now, I'm not going to say that you shouldn't take those creams. You shouldn't try some stretching exercises. But ultimately, if the curvature is really pronounced, you probably need surgery, and that's the route you should take. But unfortunately, guys, if you really want your penis to return and you don't mind a trade-off, get yourself someone that's doing nothing but Peyronie's disease, or a urologist that has a significant number of Peyronie's disease patients, and he's used to this surgery, because it's got to be precise. You can't make any mistakes on this. You know, I'm delighted with the way my penis turned out after that, because it could have been probably, it's like when I saw what he had to do, I was kind of shocked. I didn't know he was going to have to skin that foreskin back and do that. But I would still tell anybody that has a significant curvature that just go ahead and do it. You have no other route. Happy with the results. Would I do it again? Absolutely. In a heartbeat, I would do it again. Dr. Gelman, he was self-assured. He wasn't cocky. I asked other people around there, anesthesiologists, other people that I came in contact with up in the office where he worked. I made a point of asking other people in passing, well, yeah, Dr. Gelman. But some people would actually volunteer. Oh, Dr. Gelman, he's good. Yeah, but he'll be a little bit motherly, but it's only because of his concern. He's very thorough. He's not anal. He's not obsessive about anything. He's just very, very thorough, and not cocky, but just self-assured. And I felt I was in the best hands possible. When I went in, there was no doubt. I said, I wouldn't want anyone else working on me. So, and the follow-up, he wanted to see me. He's seen me like 3 times afterwards. He probably wants to see me again. He was delighted that I would go along with what you're doing here. And I said, it'll be my pleasure to do this for you, if I could help anyone else with this. Because I realize now that there's not a lot of information out on this, and this is a big deal. It's a man's penis. I mean, how much more personal can that get?